Of measles since 2023 is in Pueblo. The state health department confirms someone living there is tested positive. They say they are not vaccinated and recently traveled to a part of Mexico with an active measles outbreak. On your screen right now is all the information health officials shared with us. CDPHE says there are two places where people may have been exposed, either Southwest Deli and Cafe anytime between March 17th and the 21st, or the Southern Colorado Clinic that would have been on March 22nd between 3:30 and 6 p.m. The health department has not given any more information about the age of the patient, how they're doing, or if they have any pre-existing conditions.
Currently, the CDC is tracking 5 measles outbreaks impacting 20 states. 9 News medical expert Dr. Pyle Coley is joining us now to give more context on these outbreaks. First, Dr. Coley, thank you for being with us. What exactly does measles do to your body?
I mean, measles anywhere is measles everywhere, right? For the longest time, we had been saying, oh, it's in Texas, it's not here, but now it's here. So let's talk about it. So measles is a virus that causes an infection. And it's not just like a cold. It's like one of those infections that can have very serious complications, from blindness, permanent hearing loss, seizures, even death, in fact. So anyone who might have been in those areas, they need to really be watching for the next 3 weeks afterwards, because the symptoms usually present about 1 to 3 weeks afterwards. After that 3-week window, you're sort of out of danger. And it's a fever, a cough, a red eye, and then that turns into spots on your tongues and turns into this very characteristic rash that starts behind your ears, spreads to your face, and kind of spreads down your body.
Do you always get a rash with it?
Not always, but as the fever's sort of going away, you start to get this rash. It's a classic symptom of measles. And generally, because the vaccine is so effective, we don't really see it in people who are vaccinated. It's more people who are unvaccinated or kids maybe who've only gotten 1 dose of the vaccine.
Okay. Why is it so contagious?
This virus is scientifically so fascinating because it really does a lot of cool things. So one is it has something called airborne transmission, which means, let's say you have measles, you cough in a room, the virus can linger in the air for hours after you leave. And so somebody else comes in, never even came into direct contact with you, but just with that cough, and it's lingering in the air. So that's called airborne transmission. So it has that. It's incredibly contagious. So one person that has measles infects on average 12 to 18 other people. So the actual characteristics of the virus make it really contagious. You can be contagious before you're symptomatic. So you're spreading the virus around without even knowing it, and the contagion period is actually quite long. Now, couple that with the fact that a lot more people are not getting that MMR vaccine, and that's how it's spreading so quickly.
Okay, so this is a little bit different. So I remember with COVID, we got used to that term social contact and social distancing. But this, you don't have to be near somebody. So what, it's like 2 hours, right, after it lingers?
That's exactly right, yeah. 2 hours, and that R naught, remember that number from COVID, R naught, how many other people it infects, can be a lot more people. So really people need to start thinking about protecting themselves and their kids, especially if you're pregnant, you're younger, or you're older, but actually anyone across the spectrum, to start thinking about whether or not you have enough immunity against this infection now that it's here in our state.
So I bring that up because I want to ask, are we going to see this one case in Colorado, should we anticipate it growing in our state?
We can. And this is where the CDPHE has really asked Coloradans to think about their immunity, because we don't have a great sense of how many of us are immune. Now, if you've gotten 1 dose of that MMR vaccine, it's a 93% effective coverage. 2 doses is 97%. If you're born before 1957, you're probably immune because you've had the infection. That was before the MMR was around. But really, those people born between 1957 and 1968 may have gotten an older version, or they're immigrants, or people who may not have decided to vaccinate their children or get vaccinated. So it might not be a bad idea to talk to your doctor about whether it makes sense to check your titers, which is a blood test that tells us whether or not you're immune. And once you're immune for life.
So we're running out of time, but I feel like there's a few critical things that we should talk about. We know that of all of the cases that we've seen this year, 14% of those people have ended up in the hospital. What is it, you talked about a fever and a rash. What is it that makes some people get so sick they have to go in the hospital and it become even more complicated?
So 1 out of 5 people who are not vaccinated will end up in the hospital. And you're going to get a certain number of deaths from this. And it's really the severity of the immune response and the organs that it infects. So it can infect your lungs, it can infect your ears, it can infect your brain and cause an encephalitis. And these are the ways in which it kills people. And again, the ones that aren't vaccinated are the ones that are going to have these types of complications. And unlike other viruses, guys, where it's only young and old people, this one can even kill young, healthy people very efficiently because it's such a serious virus. So really go and get vaccinated, talk to your doctor about checking your titers so that you can protect yourself, because now that it's here, airborne transmission, very contagious. It's going to be hard to avoid it unless you're vaccinated.
All right, Dr. Coley, we appreciate your time this morning. Thank you. By the way, you can find all of Dr. Coley's appearances at 9news.com/Dr. Coley.